Hi everybody, welcome back. In this next segment of our myofascial release series, we're going to be releasing out through the front and back of the thigh. So for this one, we'll need our myofascial balls, but primarily our roller. So we're going to grab hold of our roller. Don't worry if you don't have a long roller, whatever roller you've got is fine. If you have a very hard roller though, you might like to place a towel and fold it up a couple of times over the top if you feel quite sensitive. I'm going to start rolling out the quads. So the quads run down the front of the thigh and also to the inside and the outside. So they actually, they create, they cover quite a large portion of the thigh. So I'm going to start with my roller across my mat. And I'll come onto the roller and I'll stay onto my elbows for the moment. Don't collapse into your elbows and into your low back. Press down into the elbows. Allow your upper arm bones to grow long. And then from here, start to glide very slowly forwards and backwards, just to see how you feel. Now notice the position of my feet. My toes are facing straight down and my heels up, so that I'm rolling the center of the front of my thigh. If you haven't got your elbows in the right place, and I see this a lot, if people are a little too far forward, they'll hunch their shoulders up to their neck, but if their elbows are a little too far back, they'll end up having to hunch their spine to come forward. So play with the position of your elbows to make sure that you've got a comfortable shoulder position. As we roll forwards and backwards, notice, does one leg feel a little different to the other? And then what I'm going to do is I'm going to turn my toes towards the camera. And that means I'm going to start to roll out the inner part of my right quads and the outer part of my left quads. This can be a little more intense on both sides because those tissues are a bit more sensitive. And I'm going to go very slowly, quite smoothly forwards and backwards. Try that out for size. And then come through center, and then I'm going to turn my toes away. And that means I'm now rolling the outer part of my right quads and the inner part of my left. Good. So notice how this feels. Another technique we can do is turn out both feet. So if you notice that your inner quads, maybe going into the inner thighs, is really tight, turn the toes out and the heels in. Or similarly, you turn your toes in and your heels out as much as you can. Now there's a lot of conjecture about rolling out the ITB, so some of you might be thinking, oh yeah, but I roll out my ITB and it's hideously painful. It's going to be painful for everyone because you're rolling out a tendon, so it may actually not make that much difference. My advice to you is to roll out into the lateral calves or the outer part of the calves, so this area here where there is meaty tissue that can be affected, and also I'll show you a technique for the hips. So we can do that as long as we feel we need to. If you're grimacing and gasping for breath, please do pull back. I've seen that happen. That means you're just going a little bit too intensely. So the other alternative is to grab hold of the balls and you bring those to wherever you feel you need them in your calves. And here you've got just a little bit more control. You will have to work a bit more firmly through the elbows and you can move the leg around. So this is if you want a bit more of a local treatment. So that's working on the front of the thighs. To do the inner thighs, we'll lie to the side and we have to find just the right position for the roller, especially if you've got a long roller. So I'll come all the way down. You can use a cushion for your head or cradle your head in your bottom arm. I'll just move the roller for a second. My bottom leg is straight and it's behind the line of my hip. And then the roller is going to come quite low down and on an angle, so that I can place my top knee, my right knee, onto the roller, and then I'm going to roll forwards, massaging my inner thigh and backwards. And you can gauge wherever you need to place the roller, making sure that it's quite low down so you've got some space as you roll into the inner thigh. So the inner thighs are kind of skinny superficially, but they go right deep down into the bone. And of course you can change your body position around to give you just the right position so that you're rolling out where you need. So to go right into the inner thigh, bring yourself a little closer and press all the way in. Again, we want to avoid bones, which will be hard in this position anyway. If you feel any shooting pain, please stop straight away. All right, so that's rolling out into the inner thighs, and I'll just do one side for now. You can pause this video and do the other side. And next of all, we're going to go into the hamstrings. So for the hamstrings, I'm going to grab this. I'm going to place my yoga tune-up balls in their little tote, or your tennis balls in a sock. And I'm going to have a seat on a chair. Often I'll do this when I'm at the airport, or even when I'm flying to release out tight hammies. I'll place the balls at the back of the thigh, but in front of my sit bone. So I don't want to be sitting right up on top of the balls, placing too much weight just on the inside of the sitting bone, because that can irritate the sciatic nerve. And that's another reason why I don't do this with the legs straight out, because as soon as I do that, I can feel tension and a little bit of a tug through the back of my leg. So just in case I irritate that, I want to be a little careful. Also, you can use the sides of the chair if you've got sides, just to roll yourselves forwards and backwards over the top of the balls. And you can place them however you like. So they can be placed one on top of the other, and you can sort of glide across. Experiment, move the balls around, glide forwards and backwards, and feel out wherever you need to release. As a rule, generally keep the knee bent and avoid the sit bones. If you want to do this on a roller, it's a little more work. So what we'll do is we'll pop the roller just underneath our thighs. We'll come up onto our hands and we'll roll forwards and backwards. It's pretty hard to roll the hamstrings, they're quite meaty, so you might not feel that much here. The roller is not as intense as the ball, so if you straighten your knees with this one, it's okay. But it's more of a pleasant sensation than a real release. All right, so that's fronts, inside and back of the thighs. And then if we want to make a real change to the side of the thigh, and I spoke about the ITB earlier, a nice place to release, and I'll use a tennis ball for this because it'll be a little easier for you guys to see it against my clothes, is to feel here for your hip bones, and then feel for the part of the leg that sticks out, so the greater trochanter femur, if you know your anatomy. And then come to the inside here, and you can feel the muscle here, which is called the TFL. If you sit long, and you pull yourself forward and you internally rotate through your toes, you'll feel a little jump of muscle around about here. It would be where your jean pockets would be, so right around there. And I'm going to make sure that it's not on bones. It's kind of in the soft part of the muscle. Onto my elbow. And I roll forwards into that tissue. Explore around. Go front to back. And it can be a little intense. Try to relax over the ball as much as possible. And you can roll a little further back if you'd like to. Just exploring, you might even go as far back as the top of the glutes, getting into the glute med. And if you find a tight spot here, settle yourself down and allow yourself to sink down onto the ball. Remember to avoid any very painful spots or to avoid the bones. You don't want to be bruised the next day. So as a general rule, whenever you're rolling out, make sure you can breathe, make sure you can have a little smile on your face, and that you're not feeling shooting pain, you're not feeling any numbness or tingling, and you can enjoy the experience. It's more of a sensation than a sensation. All right, so in the next video, we'll look at the lower back and the glutes. Thanks for joining me.